we spoke earlier also to Dr. David Nabarro, who is the WHO Director General Special Envoy for COVID-19 response in India. And I began by asking Dr. Nabarro about the importance of groups like MSF and WHO's experience of working with them.
When we're dealing with a major global issue like what we're experiencing now with COVID, we all need to work together because it's a problem affecting the whole of humanity. And it really does require partnership between all who have the capacity to help. Within public health, we have many organizations that put the needs of people, particularly poor people, really up front and at the center of attention. They want to leave no one behind. One of these organizations is Médecins Sans Frontières, or Doctors Without Borders. I've actually been working alongside and often with this organization for many decades. And I'm totally impressed by their absolute dedication to serving the needs of the person who is ill, the person who needs help, regardless of who she or he is, regardless of wealth, regardless of nationality, just always saying that an individual's life and well-being is the most valuable thing in the world. And this is the commitment of Médecins Sans Frontières. Now, there are many other organizations that do the same. And so I hope that in the telethon, you will pay respect to and get support for all the organizations that are totally committed to helping people recover from disease. And I'm so glad that there's a particular focus on COVID, because this is causing such huge problems around the world, particularly for poor people, for people who live in very crowded settlements, for people who are unable to navigate to get safer working conditions in their places of employment. They need support, and that's why Médecins Sans Frontières is so important at this time.
Dr. Nabarro, what are we learning about the virus that's important for frontline workers like Médecins Sans Frontières?
So perhaps the most important learning is that this is a really dangerous virus. It's very easy to underestimate it because the fatality rate is relatively low, but it has a lot of other impacts on people's well-being. And the fact that it does unfortunately kill a significant number of people does mean that we have to take it seriously. Second learning is that as soon as an outbreak appears in a locality, it's necessary to try to stop transmission with immediate effect. This does not mean having a whole lockdown on the country, but it does mean identifying where the virus is and acting quickly to interrupt transmission and ensure that people are not exposed. Thirdly, and perhaps my last point for now, is that it's really important that hospitals and health centres are properly supported, because health workers experience a high exposure to the virus. So enabling health workers to protect themselves whilst ensuring that hospitals can provide the best possible service and prevent people from dying is absolutely critical. So being able to act rapidly, being able to ensure that health services work, and taking the viruses seriously, they are key learnings that I've certainly picked up over the last few months.
Dr. Nabarro, would you praise India's efforts given how the virus is surging?
So firstly, I want to stress that the best way in which we control this virus is by interrupting transmission wherever it occurs. But it's really hard to do that in densely populated areas. It's really hard to do that when you've got millions of people who are perhaps migrating away from their homes and coming to work in cities and then suddenly finding the work is not available anymore. So it's a tough thing to do to contain this virus. And I'm really impressed with the speed with which India reacted. But I'm also aware that the problems are there still now. What I want to stress to everybody is that if India had not been strong at the beginning, the virus would be much more widespread in your country. You'd have a doubling time of infections of 3 days. As it is, you've been able to slow the doubling time, and that's been remarkable. Secondly, you've got much greater public awareness of what's needed now as a result of the lockdown than would have happened if you hadn't done so. So all I want to say to everybody is this is a tough virus to control. It's very difficult to contain outbreaks. But if you had not acted in the way that you have, your situation would be much, much worse. And I ask you please to continue with the same strategy, because that's the only way that we know for controlling this disease, interrupting transmission, isolating those with the disease, and protecting those who are at high risk.
Dr. Nabarro, it's been a privilege speaking to you, and thank you very much for sending out that strong message that we need to keep alert to the dangers of this virus in the manner in which we tackle it.